Namaste friends, welcome. I'm so excited to share with you one of my favorite simple hacks that will really start to change your life. And I know I say that a lot, but this one is really such a doozy and it's such a simple muscle to activate. And it's a really hard muscle to activate, but I'm going to give you a really easy way to hack into it. And that muscle is the Quadratus Lumborum, or otherwise known as the QL. So the QL is an interesting muscle. If you want to follow along with me, you can find the QL. It kind of comes at the top of the pelvic bone. So right here you can feel the pelvic bone, sometimes referred to as the as is. And if you follow it all the way to the spine, you'll feel the crest of that bone and close to the spine. And so at the crest of that bone is the muscle, the QL, and it comes from here and attaches up to the bottom rib and then also attaches to the spine. Now this little muscle, oftentimes people will say things like, I threw my QL out, or my QL is inflamed. And they say that with good reason. And one of the reasons why the QL often goes out is because it gets overused. So one of the reasons, or one of the things that causes a lot of muscles to not function well, is stress, trauma, and overuse. One of the functions of the QL is to come into back bend. It does have some rotational quality to it. And of course, it's also a huge side bender as well. So it controls the relationship of the spine, or helps to control the relationship of the spine in relationship to the pelvis when we start to go through these different ranges of motion. Now, here's the interesting thing. I've been talking to a lot of students recently who have been having TFL, tensor fasciae latae issues. So you see a lot of people always doing foam rolling on the side of their leg here, and because they have a lot of pain in their hip, and usually it's not the hip that's in pain, it's the TFL that's just really tight. Well, one of the reasons why the TFL starts to get tight is because the body senses instability, specifically in this case in the pelvis and hips, and it sends out like this nationwide Amber Alert, like tighten up, tighten up, tighten up, tighten up. So in order to get the TFL not to be so tight, we need to get the other muscles to start doing their job. And once the body senses stability, it stops sending out that Amber Alert, tighten up, tighten up, tighten up. And the body is able to start to relax a little bit more. So this is an exercise for you if you want stronger, healthier back. Hello, who doesn't want that? And then also, if you have a tight TFL, if you have any back problems, and then C, if you want more range of motion. So one of the poses that we often do is a pose called triangle pose. So what I'm going to have you guys do is just do a little test. I always love to do tests because I think that that starts to become real for you. So what I want you to do is to stand up. And as you're standing up, bring your feet wide apart. Bring your hands to your shoulders, to your elbows. And all I want you to do now is bring your right shoulder to your right hip bone. Okay? Now from here, let your right hand come down and let your left hand come up and maybe even over the head, and just kind of notice where that hand is, okay? Now you're not thrusting this hip out. So one of the reasons why I want you to keep your toes pointed in is because it blocks the hips from you going into your hips to increase the range of motion. All we're trying to do here is test the QL's ability to contract properly and see how much it's capable to contract. So my hand, about 3 inches below the knee. I'm going to come back up, recross the arms, hands to elbows, and bring your left shoulder to your left hip bone. And then again, bring your left hand down, just kind of landmark it. And then bring the other hand up if you want to, or over your head, just to kind of feel this side body starting to engage a little bit more, and then come on up. Right, so let's come on to our backs now. Now the technique to engage the QL is what's often called a hip hike. And it's kind of hard to explain, so I'm going to do my best, and hopefully this will help you. By the way, this is also available in my book with clear explanations titled Stop Stretching, A New Yogic Approach to Master Your Body and Live Pain-Free. So, coming onto your back, you're going to straighten the legs. Now I'm going to lift my shirt up a little bit. Not that you will be able to see that much, but it may help you to understand. So right here is the hip bone. Here's the pelvic bone. And here is the floating rib. And so the hip hike is just gently pulling the hip bone towards the floating ribs. And you're going to kind of do this movement. It's almost like you're tilting. Now, what a lot of people sometimes do is like lift up and then pull. I don't want you to do that. You need to keep both of the pelvis, sides of the pelvis on the ground, and you're going to just rotate the pelvis up. Now, if this is hard for you, by the way, that's a really good sign that your QL is not working well. So we need to improve its function and then relax. So we always hold the muscle activations for 6 seconds and we do it 6 times. So you're going to roll in or pull in. 2, 3, 4, 5, 6, and then relax. And then do it again. 2, 3, 4, 5, 6. Now relax. So that was 3 times. Let's bring the fingers in close to the spine and kind of dig them in, and then do it again, and you should be able to feel that muscle contracting, shortening. 3, 4, 5, 6, and relax. And then do it again. 2, 3, 4, 5, 6, and relax. And then do it again. So one of the other functions of QL is to maintain stability of the lumbar spine through different ranges of motion. You think about how often we go through different ranges of motion. Our hips are twisting, torquing, moving around. If that muscle isn't working, do you think that the lower back or the pelvis is going to be stabilized? We hear so much people talking about these pelvic resets. I would opine or suggest that getting the QL active is a great first step in relax to getting more stability and quote-unquote resetting your pelvis. Now I'm going to flip around just so that I can show you on this side as well. And so again, you're going to pull the hip bone up towards the ribs here. So do that again. Pull the hip bone up towards the ribs. 2, 3, 4, 5, 6. Now, there might be a tendency to push the opposite foot away. I don't want you to do that. Don't worry about the opposite leg. Just pull the hip bone up towards the ribs. And 2, 3, 4, 5, 6, and relax. And do it again for 2, 3, 4, 5, 6, and relax. And do it again for 2, 3, 4, 5, 6, and relax. And do it again for 2, 3, 4, 5, 6, and relax. And do it again. 2. So as I'm doing this, I'm feeling my QL. I'm going, oh, that's such a nice, delicious contraction. Oh, and then relax. And then do it again for 2, 3, 4, 5, 6, and relax. And one more time, just for fun. 2, 3, 4, 5, 6. Yay! All right, so let's roll over and come on up and retest. And as you stand up, just kind of notice how you feel. Sometimes you might notice that there's a difference in the way that you feel. There's more stability, more blood flow, more range of motion, that sometimes you're not really sure of your footing as you're standing, but when the muscles are stronger, there's a sense of clarity or a sense of space, that you have peripheral awareness of your body, and there's proprioception between the brain and the muscles. Woo! So many big words, I know. So bring your legs wide, cross your arms, and let's just see what happens. So bring your right shoulder to your right hip. Sometimes when you do these as a follow-up, you'll just notice that it's just easier. But let's see where we end up. So I think I got about 2 or 3 inches of range of motion. Yay! Not that that is ever a goal. It's never a goal really to increase range of motion, but I like to just use that as a kind of barometer for sometimes for you to see like, oh yeah, it's not about stretching. Stretching is really the wrong attitude here. We're not stretching anything. All we're doing is getting the brain to connect to the muscle so that muscle can shorten properly within a range of motion. Let's recross the arms and then come on to the other side and then come on down. And again, I picked up a little bit here. You can bring the other hand up if you want. And it's really fascinating to me because all we did was just improve this very small muscle's ability to contract and contract properly. So friends, please do that exercise if you're dealing with any kind of knee problems, any lower back pain, any kind of problems in the TFL, or you just simply want to have better ease as you're doing some of these side benders in your yoga practice. Definitely include the QL as part of your routine. Namaste, my friends.